At the start of the pandemic, the Compass leadership was rightfully concerned about the physical health of our clients. And so we really focused on making sure that all of our clients were safe and that they were linked to a primary care provider. So in Healthcare Home, we ran reports out of Care Manager and looked at everybody's chronic condition and gave specific educational pieces to our integrated health specialists so that they could go over those with their clients. So while our caseworkers were always focused on the 8 dimensions of wellness, I think the pandemic really drove home the point of how important it is to pay attention to the physical health of our clients and how important it is for everybody to be linked to a primary care provider. And now the agency as a whole is really focused on making sure all of our behavioral health clients have a primary care provider and are using that provider.
The challenge put to our staff, which is the first modern generation of mental health professionals to face a global pandemic, was to determine whether mental health services would be relevant in the face of a pandemic. Despite the closing of almost all other businesses, our staff showed up, saw clients, and put their personal concerns aside. The fundamental understanding that what we do is life-saving, that we have a critical foundational skill set that allows our clients to not just survive the pandemic, but thrive in the midst of adversity, animated our staff. They covered long and frequent shifts when colleagues were out, adjusted to a new workflow of service delivery, worried about their health and the health of their families, worked hard to balance the many different viewpoints of the pandemic without alienating their clients, and ultimately stood shoulder to shoulder with colleagues, the community, and their clients to prove that mental health services aren't just relevant, but are essential in addressing a pandemic.
There are so many different things that we did, but only a few that really stand out. And our staff came up with some innovative ways to go and meet with their clients during the pandemic, which also kept, the anxieties reduced for the people that were serving and our staff. There was something called lawn chair visits, and so they still wanted to see their clients, so they would sit outside and social distance and be able to continue to provide that face-to-face service. They also delivered food and meals to their clients, and while they were meeting with them, continued to provide that service and face-to-face. We also did some things within the office where clients would show up for telehealth visits. We had to real quickly provide telehealth services and telebehavioral health, and not everybody has that ability to do that in a rural area. So we would provide clients, even in the parking lot, an iPad or some kind of a device to be able to see their provider and practitioner to still obtain their medications and things.
Clark Center, we recognized that we already had a transportation problem, and many of our clients had transportation issues before the pandemic, and then Medicaid transport ceased to pick up our clients and bring them to services. I also needed to protect our staff from getting COVID, and so we immediately went the redneck route, and we figured out a way to make what we called COVID cars. And it's amazing what you can do with PVC pipe, duct tape, and clear shower curtains. And we had the PVC pipe bent with flame and shaped to the roof, and it put a protective barrier between the back seat and the front seat so that we could protect our staff and clients and continue to get them to back and forth to appointments until we were able to actually find a dealership that was willing to retrofit some of our vehicles, and we now have 4 permanent COVID cars.
So the big pivot obviously was to get to the point where you were able to use some sort of virtual setting. Now the thing that helped us along is prior to the pandemic, we were providing virtual services with psychiatry and therapy. We were able to pivot very quickly and bring on case management. So when case managers were allowed then to provide services via whatever platform you use, whether it was Zoom or another platform, we were able to take the learning we had already had with psychiatry and therapy, talk with the case managers, let them learn in a virtual way, and them to pick up on it. So we really didn't miss a lot with training a whole new part of the workforce, which honestly is larger than the psychiatry and therapy part of the workforce, in a fairly quick manner. Also, our IT folks were already used to working with us in a virtual world, and all they had to do was cut on a few more things for the case management folks. So I think that was one of the things that, just by virtue of us already doing it, we were able to pivot very quickly and then bring that portion of our workforce into a virtual world.
So the kind of pivoting we had to do was quickly supply all of our staff with the right technology to be able to connect with clients and others in the community remotely or virtually. So that meant buying, more laptops, tablets, making sure they all had good Wi-Fi or extra connections of some kind so that our staff were able to engage with people in the community virtually. And then we also invested heavily in Zoom and Doxy.me and Teams as a way to carry on meetings, and sometimes those were client meetings or they could just be staff meetings that we were able to do virtually. We also supplied tablets to law enforcement so that our law enforcement officers were able to have a way to connect to us when they were encountering somebody in the public who was struggling with a mental health challenge.
I cannot say enough about how amazing our staff were regarding their flexibility, and just them being able to come up with different ideas that they were able to do in the community. One of our staff members came up with something called Hope Rocks, and so just to be able to reach out to those that might be walking, doing exercise at the local track and things, and they would place just inspirational messages on some rocks that people could pick up and take home, and that was just wonderful.